welcome back to my YouTube channel. My name is Maria. If you watch this video and you enjoy it, don't be shy, hit the like button and subscribe to my channel for any future videos on narcissistic abuse recovery and complex post-traumatic stress disorder. Alright, so we're going to start something new today. I decided to start a series for self-care and CPTSD. I know that a lot of times when we're going through these symptoms of CPTSD, this vicious inner critic, the toxic shame, the emotional flashbacks, the social anxiety, it is very hard to think of putting ourselves first. But these are just going to be some ideas of different ways in which you can give your mind a break by focusing in on the body. All right, so let's get started with our first guest today. Hey guys, welcome back to my channel. Today I am here with a special guest, Andy Levon Clayton. Hey guys. Andy is a neuromuscular therapist and a licensed massage therapist. So I thought I would have him on here today to talk about some of the benefits of therapy, neuromuscular therapy, and CPTSD and mental health in general. So thank you so much, Andy, for coming.
Thank you for having me, Maria.
You're very welcome. So I'm going to start off by asking you what neuromuscular therapy is and what you do.
Okay. So it's a big bag of a lot, right? But the short version is neuromuscular therapy is soft tissue manipulation. Okay. But when we talk about science in general, it's usually a huge ocean of things, a collective of things, right, that make up the science. And so a part of that is pain management. So people who deal with scoliosis, if it's not something that was onset at birth, it's something that we can actually correct. Okay. So people are walking straighter. People with nerve damage that was maybe sustained during a car accident 4 or 5 years ago could be entrapped, some type of nerve entrapment. Those are the types of things that we can fix that can cause or just bring alleviation to, people. People with constant migraines, that could be caused by what's called trigger points. Trigger points are... think about a knot on steroids, right? That's essentially what a trigger point is, and it can cause all sorts of issues. What I do as a neuromuscular therapist, I kind of figure out what the pain is, right? If it's a sharp pain, a dull pain, how long you've been dealing with the pain, it gives me the information needed in order to really correct the issues at hand, and really understanding the history and maybe even psychologically where you are as well, because sadness does have its own emotional, physical stature to it.
Right.
You can see people who look sad, you can see people who are super happy too, and there's also neck trauma that comes from that. So there's all sorts of things that neuromuscular therapy addresses, very little that I can think of that I don't actually do for people.
Okay, so if we're looking at neuromuscular therapy and mental health, how do you think they are interrelated?
Oh my goodness. So let's start with breathing, right? I find that breathing is probably one of the hardest things for pretty much everyone to do.
For sure.
First of all, a lot of us don't even know that we're even doing it correctly. A lot of us do what's called paradoxical breathing. Have you heard of this?
No.
So paradoxical breathing is when you inhale. I'm trying to do it. Is when you inhale, but your chest caves in. So it's kind of a weird thing. And then when you exhale, your chest opens. Paradoxical breathing. Do you feel how strange that is?
Yes, tight.
And if you're practicing this, you'll find that your heart rate starts to change. It starts to increase, right? If you're just trying to see what this feels like. Now, what the proper breathing you want to do is called diaphragmatic breathing, right? So you have your diaphragm that sits right here, and your heart kind of sits right on top of your diaphragm, right? And the really cool thing that happens is when you pull your diaphragm down, your ribs, the reason why they're kind of set the way they are is so that they can expand, so that your lungs, when they expand, you see how my belly had to come out? That's because my diaphragm pulled out. Now my lungs are expanding full of air, and when you exhale, what happens is the diaphragm comes up and it massages your heart.
Wow.
Yeah, it's kind of cool.
Yeah.
And so I always tell people throughout the massage, it's very important to practice the breathing, because not only are we massaging our hearts and we're getting things to slow down, including our blood, right? We have blood traveling through, but we're also getting our lymphatic system to increase up to 50%. Through massage, you can actually increase the lymphatic system 25%. You do more work with lymphatics just by breathing alone and making sure you're properly breathing. And so you find yourself in stressful situations. It's important through massage, through the practice of massage, you'll find that muscles tend to relax more, a lot easier when you're breathing properly. And when you find yourself in stressful situations, because it's kind of stressful when you have your muscles worked on, it's kind of like, ooh, okay, breathe through the stress, breathe through the stress. It's great practice for real life situations. When we find ourselves stressed out, we find ourselves short of breath, you start to recognize the symptoms first, because your heart will start to talk to you. And through massage, you start to learn how to listen to yourself. And so I know that's a lot. It's a lot.
No, that's fascinating, because that sounds like it's something that would really help with anxiety. To be able to say, you know, I can feel that. I can feel my chest tightening. I can feel the way my body is. And I must be starting to have a higher level of anxiety right now. And then to be able to use the diaphragmatic breathing to bring your heart rate down.
Exactly.
Yeah.
Exactly.
So, a lot of the people that are watching have complex post-traumatic stress disorder, which is kind of like the aftermath of emotional abuse that can happen in relationships or childhood. And if you do have CPTSD, you may be suffering from a toxic shame. You may be suffering from a negative inner dialogue, self-abandonment, social anxiety. So when we're talking to people that are suffering from all of these different things, how do you think that neuromuscular therapy could help with CPTSD?
Great question. And I'm glad that we're kind of diving towards this way, because now that we've kind of like built up all this information, and it'll make it easier to digest this next part of it.
Okay, great.
So let's talk about physical trauma, right? Maybe whatever happened, right? Like you've experienced some type of physical trauma that prevents you from being able to even move your arm properly without pain, right?
Yeah.
Those types of things might prevent you from doing things you love, such as painting, exercise, maybe even driving isn't as, you know, as fun as it used to be. I mean, it's already difficult to do in Los Angeles, but you know, it complicates things. And I find, and I found, and I see, hurt people tend to hurt people, right? But after they get off my table, it's a much different experience for people. They feel renewed. They feel a reinvigoration for life, because that pain that they've not only become so accustomed to, it's actually something that tends to define people. You know, oftentimes when they get off my table and they're like, oh, the pain's gone, they start to make this motion looking for the pain, and you can kind of see that there's a little bit of a disappointment that it's gone.
Okay.
And so it's these pains, it's these limiting factors that we've become so associated with, we've become so partnered and akin to, that we allow it to stop us. Now that it's gone, it allows people to move forward with activities and projects and things that would make them feel better, help them build trust, you know, amongst other people. Once you can trust yourself, you know, and start listening to yourself, and when you're doing self-care and massage, that's what happens. It's another form of meditation. It's a place for you to actually stop, be patient, because you can't rush through self-care and massage. And it's a place for us to listen, and that's the hardest thing to do, is to stop and listen to ourselves and to hear what our hearts are really telling us to say. You know, like the head can get angry, but the heart's telling you, okay, relax, calm down, step away from the situation. But it's hard to do that when the head is so loud. And so how can this help people with CPTSD? I believe that it gives them the proper tools in order to engage with life in the way that they feel is necessary, and probably, I don't even want to use the word normal, but what they would feel better about. Yeah.
That is so cool. So this is kind of a form of mindfulness.
Oh, yes, absolutely. I mean, even for me, at the end of a massage, people ask me, so how much is it? My mind is blank, because I'm so focused on this situation of of listening to their muscles, like it's not just it's not just them who's going through it, but it's me as well. And so as a self-giver, you're going to find yourself in a meditative state of mindfulness the entire time. And it's wonderful. It's wonderful.
That's
practice.
amazing, because so many people with CPTSD, I mean, these intrusive thoughts, the compulsive thoughts, just to be able to get that sort of relief for the amount of time that they could be seen by someone like you, or, even just that break from the compulsive thoughts is like key to CPTSD. Well, thank you so much, Andy, for talking with me today. You are amazing. This was great information. I am so happy to have you. And guys, if you enjoyed this video, go ahead and give it a like, subscribe to my channel. If you have any questions or comments for Andy, please feel free to leave them in the comment section below, big or small. We are both here for you. So, as always, I wish you all the love in the world.